I'm still amazed that we have to still discuss this vitamin K issue. Hey there, fellow mortals. It's Ken again, and this is another FTP from the Pit Fast Track. Evidence-based, no polish, no pretense. And remember, I am an emergency medicine physician assistant, but I am not your physician assistant. And I'm just going to get right into it because, there's nothing really else to do but just get right into this, because the fact that there's still people who don't understand or spread misinformation about this is just, it's getting out of hand. But here are the basics. All babies are at risk for vitamin K deficiency. Okay? Vitamin K does not cross the placenta, so no matter how good of a diet you are keeping to while pregnant, the vitamin K that you might be ingesting, creating, is not going to cross the placenta into your child, into the fetus. Breast milk is very low in vitamin K, so even though you may be breastfeeding after birth, it's still not a good source for vitamin K. So newborns, their livers are very immature and they cannot make enough clotting factors. Their gut bacteria is not yet established and cannot help produce vitamin K. And this is all independent of a healthy pregnancy. Everything else can go right with, or everything can go right with your pregnancy, but this vitamin K issue is still going to be a risk. Okay, and this puts all babies at risk for vitamin K deficiency bleeding. This is uncontrolled bleeding due to low vitamin K, which is an important part of the clotting process. There's three phases. There's early, which can occur in the first 24 hours. There's classic, which can occur in 2 to 7 days. And then there's late, which can occur 2 weeks to 6 months. And it's that latter one, the late vitamin K deficiency bleeding, that is the real concerning part. 30 to 60% of these involve a brain hemorrhage, which can lead to death or permanent disability. Right? The risk of bleeding is without the shot. Without the shot, 5 to 80 per 100,000 births develop vitamin K deficiency bleeding. With the IM shot, virtually zero. Oral vitamin K doesn't really have that great of an impact. You're still going to see 1 to 4 per 100,000 births affected by this vitamin K deficiency bleeding. It's an inferior form of protection. Safety, it is very safe. There's no two ways about it. This has been used for 60 plus years. We have heaps upon heaps of data on this. The most common side effect is some brief soreness at the injection site. Right? Serious reactions are extremely rare, and when it does happen, it's been associated with IV vitamin K, not IM. And when a baby gets vitamin K shot, it is IM. It is in the muscle, not through an IV. So those serious reactions really just aren't there. And yet, there are still so many myths and misinformation about this. There are some who promote the fear-mongering that vitamin K can cause cancer and leukemia. This unfortunately arose from one very flawed study in 1990. Since then, there have been at least 7 large studies, including a 1.3 million infant study in Sweden, which found no link to cancer or leukemia. The AAP, American Academy of Pediatricians, World Health Organization, they all agree there's no cancer risk. Others promote or the fear-mongering around dangerous toxins and preservatives. In some, there is a tiny amount of benzyl alcohol in some formulations, but there is absolutely no evidence of any toxicity at this very low dose. And it's really starting to become a moot point because many hospitals now use preservative-free versions. The quote, "I eat healthy and breastfeed so my baby is fine," end quote. As I've already pointed out, vitamin K does not cross the placenta. So you can be eating extremely healthy, and you can be breastfeeding. I'm sorry, let's back up. You can be eating very healthy, and it does not cross the placenta. It's not gonna benefit from your child no matter how healthy you're eating. And it's also very poorly transmitted through breast milk. So again, even if you're breastfeeding, child is not getting enough vitamin K from those routes. Right? Some say that the oral drops are just as good. Again, this does not help with the most severe form of vitamin K deficiency bleeding. It does kind of help with the classic iteration that happens earlier on, but with a more significant bleeding that can lead to a brain hemorrhage, oral drops don't have any impact. It is significantly less effective than the IM shot. Some promote the misinformation that the dose is too high and is not natural. First of all, vitamin K is vitamin K. Okay, whether it's through food or whether it's through oral vitamins or whether it's through an IM shot, it is exactly the same chemical structure. Okay, it's no different. It's no different at all. And so it's 1 milligram. It's a 1 milligram shot. It's a very tiny amount. And even after the shot, breastfed infants, the levels can drop in breastfed infants below normal by about 6 weeks. So the dose is appropriate. It is not excessive. And then the final thing is people spread misinformation about is that a lot of people say that vitamin K deficiency bleeding is too rare to worry about. It's rare because we give the shot. We've been giving it for so long. Okay. When refusal rates rise, when people stop allowing the vitamin K shot to be given, cases start to return. Okay. And when it happens, the consequences, it's just devastating. So bottom line, vitamin K, it's safe, it's effective. It's recommended by every major medical organization worldwide, not just here in the United States, not just in Europe, worldwide. It's one small injection, it's given once, it's given at birth, and it prevents a somewhat rare but catastrophic and entirely preventable bleeding disorder. There should be no question in giving this. So, remember, protect yourself, protect your crew, protect your infant, and I'll see you in the pit.